Okay, today I'm going to be demonstrating straight catheterization on a patient. This is for N104. First thing I need to do is check my doctor's order. I do have an order for a straight cath on this patient due to urinary retention. I have a 14 French Foley catheter here that I will be using to do the procedure. This depends on your patient. If you have a female, you'd be using a 14 to 16 French. A male would be 16 to 18 French. So I will bring this along into the room along with a graduated cylinder. Would come into my patient's room, make sure to wash my hands, identify my patient using two identifiers, checking patient's name band and birth date, introduce myself, let the patient know that I have a doctor's order for a straight catheterization. I'm going to go ahead and raise my patient's bed up to a comfortable working position, up to waist level. I'm going to lower the side rail on my side and keep the opposite side rail up on the other side. I'm going to go ahead and do some patient teaching if the patient's never had a catheter before, and try to educate them on that. First thing I'm going to do is just a patient assessment, checking the patient's bladder. Go ahead and palpate for any distension. Can also ask my patient when the last time was that they voided. So I have my clean gloves on now. I'm going to go ahead and just drape my patient for privacy. First thing I want to do is just clean my patient, and again, always washing from front to back using a different area of my washcloth. Repeat the same to rinse the patient and then make sure to thoroughly dry the area. I'm also just going to take a minute while I'm here, just inspect the area and just kind of visualize where I will be inserting the catheter. Okay, so again, I have my patient positioned. If I have a female patient, she would be in the dorsal recumbent position. She is supine with knees flexed and legs externally rotated. If I have a male patient, he would be supine, legs extended, and then legs slightly out to the side. So I'm going to go ahead and once I have my patient all cleaned up, take off my clean gloves. I would go ahead and wash my hands once again. And now I'm ready to start my procedure. You can use your bag for trash that your kit came in. Just make sure that you don't have to reach down into it with your sterile gloves. And I have a clean, dry surface that I'm working on here, and it is also at my waist level. I'm going to open up my sterile pack, the far side first. Left hand will open the left side. Right hand will open the right side, and then I'm opening the flap closest to me, and I'm only touching my 1-inch border, and I'm going to go ahead and square this off on my table, trying not to reach over my sterile field, and you might have to work a couple corners at the same time to get them to stay open. I am right-handed, so I am more comfortable on this side of the bed to catheterize the patient. Or if you are left-handed, you may want to stand on the opposite side of the bed. So first thing I want to do is go ahead and get these sterile gloves out of my sterile pack. The next thing in here would be my blue pad, and I want to grab the corner that's folded down, and then just touching my 1-inch border, I want to straighten this out, shiny side down, absorbent side up, and just tuck this underneath my patient. Okay, and before I touch anything else in my kit, I'm going to go ahead and put my sterile gloves on. Okay, once I have my sterile gloves on, I can organize the things in my kit. The next thing in here would be the fenestrated drape, which I'm choosing not to use. Then I also have my betadine swabs. I only have 3 swabs, and I'm going to tear the top off and then just get them all set and ready to go. I have water-soluble lubricant in here, and I'm going to open that and lubricate my catheter, and then just put it back in my container so it's all ready to go. I will be getting I have an order to do a sterile urine specimen. So I do have a cup that I'm going to keep right in there so I can go ahead and get my urine specimen at the time I catheterize. So once I have all my supplies organized, I'm going to come down to the bed, and once I am down here, this hand, my non-dominant hand, will be spreading the labia. That has to stay in place. Now I only have 1 sterile hand to work with. I only have 3 swabs here, so I'm going to take the first swab and I will do the distal labia minora from top to bottom around my sterile field and dispose. Then I will be doing the proximal labia minora top to bottom. And my last swab should be directly over the urinary meatus. I can dispose of that. Now I'm just going to, the other thing I have in here is a label. I'll just set that aside so I can label my specimen. Go ahead and pick up my catheter. Make sure the opposite end is resting in my receptacle. And I have my catheter here. Ask the patient to bear down as if to void and insert the catheter until I see urine, and then go another 1 to 2 inches. Then I'm going to hold my catheter in place so it doesn't slip out. I want to start the stream in my container. I want to get the middle of my stream in my specimen cup. I need 20 to 30 milliliters. And then I want to finish draining the bladder back in my receptacle. At this point, I could take my specimen and set it aside, continue to drain the bladder until it is empty or I reach the 800 to 1,000 milliliter according to my policy at my facility. So once I have drained the bladder or I've reached my maximum milliliter that my policy allows, I'm going to slowly withdraw the catheter, making sure my tip is intact, and this would all then go in my trash. I go ahead and I can put the lid on my specimen, clean my patient, and cover my patient back up again. I have to then label my specimen. This would go to the lab after I clean it all off. And then I would want to dump this into my graduate so that I can record and measure my results of my catheterization. The things you would want to make sure that you document for this procedure would be the reason for my catheterization, the size of the catheter that I used, my patient assessment, that I did perform the procedure under sterile technique, the character of my urine, including the color, odor, amount, clarity, if I collected a specimen, the client's response, any teaching that I did, and also then the patient would be on eyes and nose from this point on. Then I'm just going to be keeping an eye on my patient and making sure that they are voiding on their own within 6 to 8 hours. Otherwise, we may need to catheterize the patient again. And go ahead and take off my gloves after my patient's all settled. Wash my hands again. Make sure to lower the bed to the lowest position. And raise my side rail. Clean up all my things, and again, wash my hands one more time before leaving the room.